Good morning and welcome. We're glad to have you here either live or if you're watching this after we have recorded this. We are so grateful that you are part of our exploration here in healthcare. I'm Hope Helfrich and I am in the Clinical Education Department, and I welcome you on behalf of HCA, the Clinical Education team, as well as our marketing department, Scott Evans, who's kind of behind the scenes on this. What we'd like to do is spend a little time today talking about two of my favorite topics. One is OB, yay, and the other is surgical technologist. We have two wonderful people who will be talking today. Standing next to me is Kelly Fredine. She's one of the two managers of our labor and delivery area here at Wesley. And then joining us virtually is Logan Threed. He is the director of Wichita State Tech, WSU Tech, surgical technology program, and he is a wealth of information. He actually is just a great guy. So I'm glad to have Logan join us virtually, and I'm going to step aside because we are going to have some great discussion and questions. Thanks. We'll talk to you in a minute.
Hi, good morning. My name's Kelly Fredine. I am one of the managers of labor and delivery here at Wesley. I've been at Wesley as a labor and delivery nurse since the start of my career. So that'll be 17 years this January. And I love it. I wouldn't want to do anything else. And I'm super excited to get a chance to answer some of your questions that you guys have and to hopefully maybe get you interested in moving forward in this career. Logan, would you like to talk a little bit about yourself?
Yeah, you bet. Well, thank you for joining us. I'm Logan Threet, and as Hope mentioned, I am the director of the surgical technology program at WSU Tech. I'm fortunate enough to just hit my 20-year mark. I started my career at Wesley as a surgical technologist, and now I'm in the education career, so kind of went full circle from practicing to education. But absolutely looking forward to all of your guys' questions, and feel free as we go along. If you guys have more questions, just shout them out and we'll be happy to answer them.
All right. Well, we're going to get started with the first couple of questions that you guys have given us. A question from Nicole at West High School. How often do you have to do a C-section? And kind of along the same lines, how many people go into labor on one given day? So we do a lot of deliveries here at Wesley every day. We have a labor and delivery unit here in the hospital, and we also have our birth care center, which is a freestanding birthing center right across the street that is a part of Wesley. And so we are all one big happy family. And total, we do anywhere from, I would say, an average of 12 to 18 deliveries a day between the two units. And usually 3 or 4 of those are C-sections, and the rest are vaginal deliveries. How many people go into labor in one given day? Oh, I would say maybe 6 or 8. Yeah, Wesley does deliver about usually anywhere between 5,000 and 5,500 babies a year. And so one statistic I know we like to talk about is we deliver the most babies of any hospital in a 13-state area. So if this is a career that you're interested in, it definitely gives you a lot of experience. Logan, do you want to talk about how scrub techs support us in those C-sections and in vaginal deliveries?
Yeah, you bet. So that's kind of one thing that we did want to cover with a lot of your guys' questions is, we have the OB department, labor and delivery, and then, how surgical technology kind of plays into that role. So with surgical technology, I mean, there's a wide range, which we'll get into some of those questions on what our role is. But, surgical technologists do play a key role with labor and delivery and the labor and delivery nurses. So the surgical tech is there to assist, the physicians, the staff, but we kind of do work hand in hand with the labor and delivery nurses. On the education side, all of our students go through that training. So all of our students, the surgical technologists, have to rotate through all the different services that are out there, including labor and delivery. So we specifically set it up so students get to participate in C-sections, the vaginal births, things like that, so they get a really good experience since Wichita does have so many babies being born on such a frequent basis.
Yeah, so another question is from West High as well, and it's what is the nurse's role in labor and delivery? And like Logan was saying, our scrub techs support the nurses just beautifully. Hope said yesterday, and I thought she just hit the nail on the head, the nurse is only as good as the scrub tech supporting her. That's absolutely true. They are such a huge part of our team. And as the nurse, when a patient's having a baby, you are basically that patient's main support person. You are their person for their experience to help give them the experience, the birth experience that they want. And then you're also everybody else's person in the room. So the scrub tech who is scrubbed in, and they are scrubbed into a sterile field. So they are kind of stuck at their table. You get them whatever they need. You assist the doctor with what they might need. You have a couple other nurses in the room supporting you. You kind of have to be a listening ear for everyone, and at the same time, being that support for your patient. There's a great question. I like this from Elvis at West High. It says, what type of personality do you need to be a labor and delivery nurse? So I think someone who is extremely compassionate, extremely caring. I think that goes for anybody in the nursing profession. Also, I think specifically for labor and delivery, it needs to be someone with a very strong work ethic, someone who's ready to come in and do the hard work, and someone who is flexible. Medicine and healthcare in general is just an ever-changing environment. And having the ability to be flexible and roll with the changes is super important to be able to learn all the new best practices that we have to accommodate into our daily practice. Logan, what do you think are the most important personality traits for a scrub tech?
Yeah, I mean, I think you really covered quite a bit. Flexibility, compassion is definitely one of those. I mean, we'll probably talk about it, but you have super great days and some days that maybe aren't so great. So you kind of have to take the good with the bad. It is a very rewarding career. And then, like, Kelly mentioned, just being flexible. Things do change. They always change. Your day, may be a little bit longer, being on call. So you have to kind of have that flexibility. And in the end, we're there for the patient. So when things do maybe go a different direction, or your day is going to be a little bit longer, we, as a surgical tech, we make that commitment to be there for the patient, advocate for the patient, mother and child as well. So I think that's great question.
Logan, on that note, can you just give us kind of a broad overview of a surgical technologist, what their job is?
So, overall, surgical technology as a whole is we are scrubbed in with the physician during, any given surgical procedure. So, our students do get to go through every service that's out there. I saw a question that was from, Goddard, what typically does a surgical technologist do? So as Kelly mentioned, we are in a sterile environment. So the surgical technologist is responsible for setting up the sterile field, preparing supplies, instrumentation, and then we're kind of the physicians or the surgeon's, right-hand person. So we're scrubbed in with them, participating in the surgical procedure, working with the instrumentation, maybe helping with retraction. I kind of tell students things that we can't do is cut or alter tissue, but that's the nice part about our job is we get to be, scrubbed in, hands-on with the patient. So lots of different routes you can go on top of labor and delivery, but again, setting up the sterile field, maintaining the sterile field, advocating for the patient, and just being the surgeon's right-hand person. Sometimes it's just the surgical tech and the surgeon that are scrubbed in, so you can play a lot of different roles.
Yeah. And on that note, from a labor and delivery nurse, there was a question from West High about what kind of your day looks like in the life of a labor and delivery nurse. Part of the reason I love labor and delivery so much is that it's never the same thing every day. You do get a big variety, especially if you're at a big facility like Wesley. You could be taking care of a variety of patients. So you could be in kind of a standard labor and delivery that day with a patient. You could be in a scheduled C-section and circulating as the circulating nurse in the operating room. You could also be here at Wesley in labor and delivery. We are our own emergency department for any pregnant patient that's greater than 20 weeks pregnant. So we also get a little bit of ER, triage, those kind of skill sets. And then we also have patients that are super early in their pregnancy or that get sick or have complications, or that we accept from our outlying communities in Kansas that we're trying to keep pregnant. They're not here to have their baby. We're trying to get them further along in their pregnancy before they deliver. And so you could be taking care of them that day. So I love the variety and that it's just truly never the same thing on any given day.
And I think that is a good point. You know, our typical day in a large hospital setting, there's first shift, second shift, third shift, and then, you know, as Kelly mentioned, you know, being on call or something like that. And that's the beauty of this job is there is no two people that are the same. Everybody's different. And that's one of the great things about this role is you could show up and your day's not going to be like yesterday or the day before. So 20 years in this, and I've not had a single regret about being a surgical technologist, that's for sure.
And I think one of the things I loved when I was a staff nurse on the floor is that most hospitals do 12-hour shifts now. And so as a full-time staff member, you work 3 days a week. You do 3 12-hour shifts a week, and that's full-time, and then you're done. So you have 4 other days of that week to do what you want. And it kind of does provide a little bit of extra flexibility to your life that I think most hospitals are kind of coming around to self-scheduling and doing mostly 12 hours, and because they've realized that employees really like the ability to have a work-life balance as well. So there is a question from Goddard that says, this is for you, Logan, what kinds of operations do scrub techs work with?
So as a surgical tech, students and or a typical surgical tech are exposed to all types of specialties and services. So a good surgical technologist is well-rounded in every specialty. So general surgery, plastics, vascular, that would be hearts. More and more we're seeing robotics. So we have a lot of general surgery robotics or OBGYN robotics, and now we're seeing robotics take over orthopedic cases. So total joints are being done robotically, spine cases are being done robotically. So, you know, a great surgical tech just has a well-rounded knowledge in each one of those service lines. So if it is just you, or it's a weekend, or you're on call, you know, you're able to perform in any one of those surgical specialties. You know, our job in the education arena is to make sure that everybody has a well-rounded experience to be prepared in the field. But once you do get into practicing as a certified surgical technologist, you kind of find your niche, what you like to do. You know, I specialized in neonate and pediatric surgery and then orthopedic and spine. So that was just something that kind of drew me to it when I practiced full time. And that's the great thing about large hospital settings is when you find that niche, they kind of let you pick, you know, what kind of cases you do on a day-to-day basis, but you do want to have an overall well-rounded knowledge of everything.
Yeah, Logan kind of spoke about just the variety of places you can work, the lots of different opportunities that you have as a surgical tech. And similarly, as an RN in a large facility like Wesley, there's a lot of opportunity for growth and development. So maybe you want to start as a labor and delivery nurse, but you have dreams of continuing your education, furthering your career. You would like to go to school to be a nurse practitioner, a nurse midwife. You would like to just advance into the labor and delivery unit itself and be a charge nurse. maybe be a manager of the unit. You know, there's all sorts of growth and development opportunities when you get into medicine. And when I started, I said I was never going to do anything but bedside. I had no interest in leadership or management. And I think that's what most people say. And then they get into their specialty and they just develop a really big passion for it and they want to see it improve and be a part of that. And so, you know, you can train to become a charge nurse after you've been here a couple of years. And then there's just lots of opportunities you can, and I think this is the same for surgical techs, Logan, you can speak to that as well, but you have opportunities for national certifications. I know in obstetrics, there's 2 or 3 different national certifications you can obtain as an RN. And those are extra credentials behind your name and extra knowledge that you have that helps you just take better care of your patients. So pretty cool opportunities if you get into this area of medicine.
Yeah, I think Kelly makes a great point. You know, something we always encourage students and or any tech that's out there practicing is advancing your education. So there are a lot of growth opportunities. And I think she does a really good job of mentioning you get into it thinking one thing, and then once you kind of get into it, you realize, oh man, I really do have a, you know, a higher passion for this. But there are a lot of educational growth opportunities starting out in surgical technology and maybe moving on into nursing and then kind of climbing that clinical ladder. So there's definitely a lot of opportunities. And I will say with, you know, Wesley, you know, they have a lot of opportunities and invest a lot in their employees to continue their education. So there's great starting points. There's smart ways to kind of go about continuing your education. So absolutely.
Yeah, so of course, we'd love to see you at Wesley if you go into healthcare. And one of the, on the lines of professional development, you know, you can work as a nurse or as a scrub tech. And if you're wanting to further your career, go back and get another degree or go to graduate school, you can do that while you're working. And one of the benefits of working at Wesley is they offer tuition reimbursement for our full-time and our part-time staff. So you get a certain amount of dollars every year that they help you pay for your schooling. And it's a pretty cool opportunity for anyone who needs to work and who wants to continue working, but also wants to slowly work towards their long-term goals. So let's see. Another question from Goddard. On a typical delivery, how many team members are there? The room tends to get pretty full. So Wesley is a teaching hospital. We're actually the 6th largest teaching facility in the nation, which I think is a pretty cool statistic, which means we have nursing students, scrub tech students, medical students. We support a lot of different physician residency programs. A big part of our team here in labor and delivery at Wesley is our OBGYN residents. So those are people who have graduated from medical school. They are MDs or DOs, and they are now furthering their experience in whatever area of specialty they're wanting to go into. So our resident specialty is OBGYN, and we have 20 of those at any given time, and they go through a 4-year residency program here with us. So in the delivery room, we always have a resident, and we always have the patient's physician that they've been seeing their whole pregnancy. You have probably 2 nurses, a scrub tech, and usually someone from anesthesia to help support the patient's pain management. So there's usually, I would say, an average of 6 people in every room. I would love an opportunity to show you guys a little video of what our spaces here at Wesley look like. I think Scott's going to get that queued up for us here. So you can kind of have a picture in your head of what we do. This is the main entrance of our birth care suites across the street. And this is one of their labor and delivery rooms. They were recently remodeled. They have beautiful spaces. They also have this little side room where family can sit, kind of still getting to be with the patient, but be outside of the immediate room. And this is just kind of giving you an overview of the room. You have the baby's bed, the warmer, the bed the mom delivers in, a little bit of extra space in the back for the medical staff. This is the infant warmer. So right after delivery, usually the baby goes right up on mom's chest. Occasionally we bring the baby over to the warmer if it needs a little bit of extra help. And that's one of the machines we use for the little bit of extra help if they need it. Just a few more details of our rooms. All of our beds break down for our patients. So, and this is a fetal monitor. So we monitor the baby throughout the whole labor process. We put monitors on the mom's belly and then it transmits through that monitor so we can make sure the baby stays safe. This is the patient care board. So we like to put on their goals that the patient has. That way, any team member who comes into the room, whether it's the doctor or the nurse or the scrub tech, can look at that and know this is the patient's name, these are their goals. That's the main lobby of the birth care center. They have a beautiful space over there. This is the renovation that we're doing here in the main hospital. So this is what the main entrance is going to look like as you enter Wesley. And these are what our rooms are going to look like here on labor and delivery after they get remodeled. Right here, we're in the middle of the construction process downstairs on our main floor. So there it's showing you the doors that are going to be an entrance to a secure women's waiting area. This is our current labor and delivery registration desk and our labor and delivery waiting room in the main hospital. This is one of the new hallways that has been remodeled on labor and delivery. And this is one of our newly remodeled rooms in labor and delivery. They're all set up pretty similarly. We're really excited about those lights in the ceiling. It provides awesome lighting when you have deliveries for your physicians and your scrub techs who need to be very precise about what they're doing. And that was a part of our renovation. And then this is the entrance into our operating room suites in labor and delivery. Okay. Let's do a couple more questions. Do you guys have any questions for us that you would like to ask before we go over more of our list? If you have any, please just jump in. You won't be interrupting. Okay, let's see. So Yolanda from West High School, she had a question that's really applicable to our world right now. Does COVID-19 cause birth defects or complications for the baby? So no, it doesn't cause birth defects. Usually what we see if it comes to complications with the baby related to COVID-19 is if the mom is really sick and the baby is like during pregnancy, if the mom is really sick, the baby usually just responds to whatever is going on in her body. So if the mom can't breathe very well, if she's requiring extra oxygen because she has COVID, that could be a stressor for the baby. It's not necessarily because the baby has COVID. Usually they do not. But it's just we have to support the mom and keep her as healthy as she can be so that the baby can stay inside and stay healthy as well. Yeah, so you know, the American College of Obstetrics and Gynecology has come out with a recommendation that vaccinations are recommended for patients who are pregnant. I know kind of towards the beginning of our journey with COVID-19, we weren't really sure, and they had to do a lot more testing and a lot more research to make sure it was safe. It is something that we're recommending for our pregnant patients right now. They have better long-term outcomes if they get the vaccine. So we would encourage anybody who is pregnant to go ahead and get vaccinated for the safety of them and their baby. Let's see. So So Melanie from West High said, how often do you get emotional when working with new moms, and how do you handle your emotions when things go badly? So that's a really great question. I think when you get into this job initially, you kind of figure out, and your colleagues around you help you figure out how to balance all of those emotions. So it is, most of the time, our job is super exciting, a very happy place to work. That's not always the case. Occasionally, we have babies that have passed away that still need to be delivered, and that's our job to help them with that too. And so there are the happiest of happy days, but also the saddest of sad days. The happy outweighs the sad, but the best way I can answer that, I think, is you build a team around you with your coworkers, and your family at home doesn't necessarily understand all the complexities of what you go through at work and the challenges of balancing those different emotions, but your coworkers do. And so that's one of the things I love about our team here at Wesley. We are a very tight-knit group. We have nurses who come here who have been here for 40 years, and a lot of tenure amongst our staff, because we do have such an awesome team, and we really support each other through all of those experiences, and lean on each other. And I think that's what makes it easier.
And I can add to that from a surgery aspect as well. And Kelly's correct. I mean, we have really, really good days. We have, surgical cases that, there's no issues, complications, but we do see sometimes the worst of the worst. As a surgical tech, you do have to respond down to trauma, where you go to the trauma bay and you're not sure what's coming in via ambulance or helipad, but you have to build that relationship with your immediate co-workers, be able to call on them if you just need to run past a typical day or a hard case. And Kelly's correct. Our families don't always know what we go through, but there is a tight-knit group in surgery and in those departments that you can really just, lean out. It's best just to get it off your chest, do some troubleshooting. I still have, past coworkers that reach out to me after all these years and just say, hey, I want to talk through this. And so definitely you always have someone to rely on to kind of get rid of those bad days.
Okay, we'll do something a little bit more lighthearted. A question from Samantha at West High. What's the funniest delivery story you have experienced? And she also asked, what's the worst delivery you have experienced? So, gosh, I don't know. There's so many funny stories I can think of over the years. I had a patient who had just had her baby and really thought it was very important to wash her baby's clothes. And so she washed her baby's clothes in the bathtub and then tried to hang them over the infant warmer to dry. That's not a good idea. It starts a fire. So that in the moment, it was a bit of a catastrophe. No one was hurt, but it caused us a good laugh after the fact. I'm also thinking of recently we had a patient who was delivering, and most of our doctors have been around a very long time. Some of them, though, we are a teaching hospital, and they learn after they do this just once. But they'll sit down on the bed with the patient when they're getting ready to deliver, and it kind of puts them right in the line of fire. And occasionally, they get peed on, or they have amniotic fluid that gets splashed on them. And just the other day, it happened right in one of our physicians' cases, where she said, okay, I'll just have to step out for a little bit. She went and cleaned herself up, and then she came back. But it's always something that gives us a chuckle. One of my very good friends that I got to help deliver, she laughed her baby out. That was literally funny. I told her, you really need to stop laughing so that your doctor can make it. And she was giggling so hard, and her baby was just coming. And So we have a really good time. There is never a dull moment in a labor and delivery unit. There's always fun stories to tell and reminisce back on. And one of the things I love is that, you know, if you do go into this field, lots of times you do have the opportunity to be a part of that special day with your friends and family. And you get to come and help labor them and deliver them. And it's a really special experience for everyone and one of the favorite parts of my job. So, Logan, do you have anything to share on that note?
Yeah, I mean, you kind of spoke to it a little bit, and it, even though I didn't specialize a lot in labor and delivery, I can remember it's been a number of years ago. I got called in on it was like a late Sunday night for a surgical case, not labor and delivery, but I parked in the parking garage and was heading into the building, and there was a mom and dad that were in the parking garage, and the mother was in labor. And I really didn't know any better, so I offered to go in and get a wheelchair for mom. Went and got the wheelchair, got back out to the parking garage, and I just didn't know. So nonetheless, I get the mom in the wheelchair, and I'm flying down the hallway, and all I could think about was just getting the patient to the ER. And as we're going down the hallway, the patient's water broke, and I mean, my shoes were soaked, my pants were soaked. I get to the ER, and the ER is like, "What do you want us to do with this patient?" I mean, and I should have, taken her directly to labor and delivery, but everybody had a good laugh that I didn't know any better. My first thought was get her to the emergency room and not labor and delivery. But yeah, I mean, all sorts of things do come up that's surgery. I mean, there's a handful of things that do come up that just are either funny or strike you as odd, but I'll say after 20 years, there's not much that surprises me anymore.
Yeah. Yep, never a dull moment. So, if surgical technology is something you're interested in after high school, there's a lot of different ways you can go to get there. Luckily, in the Wichita area, we have amazing nursing schools, several different ones, all within, I don't know, a 60-mile radius of Wichita. Lots of different options to choose from. You can be an RN with an associate's degree or an RN with a bachelor's. I think if I could make a recommendation, I would recommend you go to a 4-year school where you would get your bachelor's degree and then you would test for your RN after that. But you can always you can also go a different route if you need to and do 2 years and get your associate's degree and test for your RN after that. Hospitals hire both. I think if it's a matter of, say you have 2 applicants and one has a bachelor's and one has an associate's, usually they lean towards hiring someone with a bachelor's. They just have that little bit of extra knowledge and schooling behind them. But we have some just phenomenal associate degree nurses as well. And then you gain your knowledge and experience just by time in your unit. And after you have so much time in your unit, that's when you can start sitting for those national certification exams and looking towards if you want to do further professional development and advancing your degree or anything like that. Logan, do you want to talk about how they would get started down the surgical technology path?
Sure. So the same thing as Kelly. I mean, for surgical technology, there's 5 accredited programs within the state of Kansas. We do have a program here. There are some. I always encourage students to do research. See what fits. What college is going to be best for you. Our program right now and it's an associate degree surgical tech, so it's an applied science degree in surgical technology. We no longer, it was an accreditation action that no more technical certificates. So it is a 2-year program. We kind of consider the general education and the prerequisites a year, and then the surgical technology portion of it is a year long as well. So 2 years, all in all, you do graduate with your associate's degree. And then we also strive, because of our accreditation, to ensure that all of our graduates are certified. So we do have a national certification that surgical techs take. once they become eligible and meet requirements. That is a national certification that's good in all 50 states. So, if you decided down the road you wanted to move, there are some registration requirements state by state. There are states that do require that you have that credential to work in surgery, and some of those, I think there's 14 states now. But we're kind of like Wesley, and Wesley's the same way. And a lot of hospitals, they want to see those credentials. They want you to come from an accredited program. Surgical technology program in itself, the program, so that 1 year that it is the program, it is accelerated. It's a lot of information in a short amount of time. The nice thing is we kind of do all of our book work on the front end, and then our second half of the program is all just clinical experience. So students are there Monday through Friday, getting that clinical experience in all those different areas. And then at the end, once they meet the requirements, sit for their boards, gain that certification, and then join the workforce.
Awesome. Melody, does anybody from your class have any additional questions?
No, I think we have had everything answered. Does anyone else have any questions? Yes.
And how can we start volunteering at Wesley?
Please, mask down. Say it again.
How can we start volunteering at Wesley?
Oh, I have a question about volunteering at Wesley.
Oh, awesome. Yeah, so we do have volunteer services. And they recently got to come back into the building. We had to kind of discontinue our volunteer program for a little bit of time because of COVID, but they are back and working in our facility. So, you could just call the Wesley main number and ask them to transfer you to guest and volunteer services, and they should be able to answer any questions you have about that.
And for those of you that are thinking about observations, we do have the ability to do that. We're just currently still on pause. We're waiting for members of our senior leadership team to give us permission to restart those. We look forward to having people back in, seeing kind of participating in what this whole healthcare experience looks like. I'm hoping that the COVID numbers continue to decrease and our leadership is aware of that, and we can kind of re-establish those observations. So there is also a volunteer program that we've had in the past. It's kind of something that has a highlight during the summer. I think we're still on pause there as well, just because of the age limit. We do not require our employees to have COVID vaccinations, at least at this point in time. Don't know what will happen in the future, and I don't know what will happen with students with that requirement as well. But we do look forward at some point to having the volunteer program reestablished and our observations resume.
Yeah, and that's a really great question. I would encourage you to check into that. And if you can participate in something like that, it looks really good on a resume when you're looking for a job later, and for a nursing school when you're trying to get in. Some nursing schools or surgical technology schools are pretty competitive. And so to have any sort of experience within a healthcare setting is really helpful.
Scott, do you have any clips of the operating room that you wanted to share to talk through?
The video?
Yeah.
Yeah, I think Scott's going to cue one of them up.
Okay.
Which one would you like, Logan?
Yeah, I mean, so we did put some videos together just so students can kind of see what goes into the training to become a surgical technologist. And these are ones that we could always get out, after the fact, but the open AAA procedure is one that, again, this is one that we've done here in our lab. So just something that you guys can see what we do as far as training to get our students set up and prepared for the operating room. So we have a lot of real life experience with our simulators and our trainers. All of our trainers, so we do want to prepare students for the operating room, and this is a surgical simulator that when we do cut into the tissue, it bleeds. This patient here just happened to have a ruptured aneurysm. And then we're able to go in and do a grafting repair. So it, simulates exactly what that surgical tech is going to see for anatomy, step-by-step procedures. So a lot of really cool training. And then we have some other videos. Our lab is completely equipped to teach students how to work robotically or laparoscopically. That's something that as a surgical tech you would see. But there again, the training that we do on the front end really gets the students prepared for what they're going to see in the real world.
That's very helpful. Thank you, Logan. I think there are 5 surgical technology, excuse me, I'm getting my fingers sick. I think there are 5 surgical technology programs here in the state of Kansas. They may all have this kind of level of high fidelity sim, but I know that WSU Tech really does have an extraordinary program, and it's well run, and I appreciate all the students that Logan is able to send us as well. We've got those 3 videos that we will send out here in just a bit when we send out the recording. And so just as a quick reminder, if you would please do the evaluation on today's content. We really look over those feedback, those comments. We share them with Logan, we'll share them with Kelly, so that they know just how stellar a job they did today. These guys were really rock stars. Give us your ideas about future topics, things that you'd like to see in the future. We've kind of got something we think lined up for December, might be kind of a surprise, but so many times we have questions about the OR and we have questions about OB that we were really pleased to combine these 2 together.
Yeah, please let us know what you'd like to see in the future. We'd love to be able to do something else for you guys.
All right, thank you guys so much. We appreciate your time. And again, we look forward to those evaluations. Have a great rest of your Tuesday.
Thank you.
Thanks, guys.
Hey, Scott? Scott, are you still there? Hello, Scott.